I think a great example of the benchmarking capabilities of Avant-garde Health is in a hospital system such as the one I'm in here in Boston. This is a very large and diverse hospital system that operates in different hospital settings and venues. And Avant-garde Health has been able to present data to us across the board for the hospital system. And by comparing and contrasting the data from these different hospital systems, we've been able to optimize the care pathways for our patients to ultimately improve outcomes.
I think the benchmarking has been beneficial for a number of reasons. So again, going with data, you don't know what you don't know. And in order to be able to be successful with something, you need to know where you started and then be able to know where you're going. So when we're looking at total joint cost, for instance, we're able to break down the implant cost per surgeon, and then we have the benchmarks not only in our institution, but as far as nationwide benchmarks for what cost is per implants. And if you have a target, then you're able to adjust your behavior and adjust your cost to meet those targets.
So understanding the benchmarks, how we do, how our individual physicians do against other organizations and other surgeons was a real motivator for changing their personal behavior, how they did things. Data changes behavior amongst physicians for sure.
With the benchmarking, part of that was when we were looking at our different opportunities for pricing. Our prices across the healthcare system were different, and we had previously used a tactic of our folks at corporate just made a decision about how they were going to use implants and what implants were going to be available, and we lost 40% of our orthopedic business overnight. So when we started to look at implant pricing again, and I called Avant-garde and I was like, okay, what are different tactics and strategies that you've seen that have been successful? And one of them was to really engage the orthopedic surgeons. So we implemented that, and the surgeons were part of the decision-making process. They actually went with us to meet with the vendors. They helped us determine the pricing strategies. So we went from losing 40% of our business to our orthopedic surgeons being actively engaged in the process and even in some cases kind of owning it. And it has just gone so well for us. It's been amazing.